Mental health funding temporary reallocation helps balance state budget
by amending the Mental Health Services Act, Proposition 63 of 2004, to transfer funds for 2 years
to pay for mental health services provided through the early and periodic screening, diagnosis, and treatment program for children and young adults.
Fiscal impact, state general fund savings about $230 million annually for 2 years, 2009, 2010, and 2010 to 11. Corresponding reduction
in funding available for Mental Health Services Act programs.
That's the way the prop is going to read.
I'm not sure I understand that.
I think I would vote for it.
Reading this right here, it sounds like something that you would want to get on board with.
I guess. I don't know. I'm confused.
I think the early screening for mental health deficiencies is a really good idea.
You'd like to do whatever you can to help individuals. And if this does that, then that's great.
I don't know if I have enough information on that.
To help balance the state budget, Prop 1E will take more than $460 million away from Mental Health Services Act to programs.
Despite what is implied in the description, no new services will be funded. If the initiative passes, a portion of these monies would go to cover mental health services that the general fund is already required by law.
Legislative analyst points out that potential effects include 1, a decrease in federal matching funds coming into California, and 2, increased cost for homeless shelters, social service programs, medical care, law enforcement.
This does not say this at all.
I think a lot differently about it now than I did moments ago.
So by reading what it will do, this doesn't sound like it's something that you would want to support.
I'm all for the support of mental health services because I think it's something that really doesn't get enough support. So I think the way this is written is misleading.
So when I first read this Proposition 1E, I thought that it was good because I thought it was going to pay for mental health services.
Money needed for mental health is an important aspect of public funding, and that's what taxes are for.
What this does is completely reverse what they say up front to you, and you end up voting for the exact opposite of what you were voting for.
It doesn't make sense. If it ends up costing more money and there are less services and it costs more money, that seems stupid.
Is that the point, that it doesn't make sense?